Hello, my name is Travis Pele. I'm a FNP student with West Texas A&M. I'm going to be doing my head-to-toe assessment. I have a 38-year-old Caucasian female. She is coming to the clinic today for a general physical. We've already assessed her alert and orientation. She is AO times 4, GCS of 15. We've discussed her past medical history. She has previous history of hypothyroidism, takes levothyroxine daily, is compliant, and last medication was today. She also takes a multivitamin daily, compliant, and took her medication this morning. She denies any allergies to medication, environment, and has a past surgical history of right ACL repair. She was a Gravida 3, PAR 3. Last menstrual cycle was last week. She is a non-smoker and is up to date on all vaccinations. I'm going to wash my hands and then begin the assessment. The first thing I want to inspect is her head. I'm going to be looking at hair. I'm going to be checking for pigmentation. I'm going to be looking to see the healthiness of the hair. I'm going to have her, man, can you bend your head down a little bit? I'm going to be inspecting the hair, the head, the scalp, the skin. I'm going to be looking for any break in skin, any redness, any bumps or lesions that you may see. I'm going to palpate the head. Ma'am, have you had any headaches recently?
No.
I'm going to palpate the head, feeling for symmetry, feeling for any bumps, feeling for any tenderness. I'm going to be noting the patient's face, noting any grimace with the palpation. And I note nothing at this time. Head seems to be no abnormalities noted at this moment. Can you lift your head up? I'm going to be looking at the rest of her head for symmetry, checking ears to make sure they're symmetrical, eyes, making sure that the nose and the mouth are midline. Next, I'm going to be moving on to her eyes. I first want to inspect her eyes, inspect the eyelids, inspect the eyebrows, inspect the eyelids, making sure for skin breakdown, any bumps, any redness, any drainage. I'm going to inspect the conjunctiva and the sclera. Ma'am, I want you to look up. There you go. I'm going to be looking for the oral mucosa, for the mucosa, make sure it's still pink, moist, make sure the sclera is white. Noting any kind of redness, any jaundice. These could be the jaundice could be sign of liver disease. After I inspected that, I'm going to inspect her pupils. We're going to do direct and consensual. So look straight ahead. Direct, consensual, direct, consensual. I'm going to be checking the cornea. Straight ahead. Very good. Well, I've got her here. We're going to do the near test. So I want you to look at the pin and then look at the window. Look at the pin and then look at the window. Very good. We're going to be testing our ocular motor nerves, cranial nerve 3, 4, and 6. Ma'am, what I want you to do is I'm going to have you follow the pin with your eyes. Keep your head still for me. We're going to be noting any nystagmus, any jerking. I didn't notice any on this exam. We're going to be testing for convergence. Ma'am, follow the pin with your eyes. Keep your head still. Very good. After we've assessed her, we're going to check with the, I would use an ophthalmoscope. I don't have one at this moment, but what I would use is I would have her look directly here, and I would put the ophthalmoscope to my left eye and observe her left eye, inspecting her optic disc, and it should look of a yellow circular disc. After we've assessed her eyes, I'm going to move on to her ears. We're going to inspect symmetry. We're going to be inspecting anything on on the outer ear. So we're going to be looking at her hylux, her auricle. We're looking for any drainage, any redness, any bumps. We're going to want to inspect her ear canal, ear canal. So what we're going to do for adults is we're going to hold onto her auricle. We're going to pull up and back, and with the otoscope, we're going to be using the largest spectrum that we can fit into the ear canal, and we're going to be looking at her tympanic membrane. We're going to be looking for the cone of light, looking for any swelling, any polyps, and we don't see any at this time. Next, we want to test her hearing. Ma'am, have you had any kind of issues with hearing, any hearing loss?
No.
Okay. We're going to go and test her hearing with the whisper test. So ma'am, I'm going to have you cover your right ear and then repeat what I say.
3, 1.
Very good. And we're going to do the same with the left ear. Cover your left ear.
5G2.
Very good. Next, we're going to do the Weber and the Rhine test, testing the vestibular nerve. This is going to be with the conduction. So, ma'am, what I'm going to do is I want you to let me know whether you feel the conduction on both ears or just on one ear.
Okay.
And I'm going to place this on top of your head.
I hear it in both fields.
Very good. Next, we're going to do the Rhine test, and we're going to create the same conduction, and we're going to do bone to air conduction. So I'm going to place it behind your ear, and then let me know whenever you stop hearing it. Keep your head still, and I'll put it next to your ear, and let me know when you.
Okay. Okay.
Very good. It should be a 2-to-1 air to bone conduction. We would do the same for the other ear too to confirm our findings. After we've assessed the ears, we want to move on to the nose. We're going to make sure that it is symmetrical. We're going to be inspecting for any redness, any swelling, any drainage that we may have. We're going to want to check for nasal obstruction. So ma'am, what I'm going to do is I'm going to press on your right ear, and I want you to breathe in with your left. Very good. I'm going to do the exact opposite. Very good. We're going to want to inspect the ears with our light. Ma'am, can you lean your head back ever so slightly? Very good. And we're going to be inspecting the ear, noting hair distribution, noting swelling, noting mucosa in there. We're not seeing any, we note no polyps, no swelling. Next, we're going to test the olfactory nerve. So what we're going to do is test smell. What I'd like you to do, ma'am, is close your eyes, and then on the right side, tell me what you smell.
Rubbing alcohol.
And then on the left side.
Rubbing alcohol.
Very good. So no abnormalities there. We want to go next to the mouth. We want to inspect her lips, make sure they're still pink, there's no inflammation, no swelling, no breaks in skin, no lesions. Everything looks normal at this moment. We're going to inspect her teeth. Can you open your mouth big? There you go. We want to inspect to make sure she has all of her teeth. There's no discoloration. We're going to inspect her gingiva. It wants to be just slightly lighter in light pigmented skin patients. We're also going to want to inspect her oral mucosa. While we're here, we're going to have her open her mouth, and we're going to inspect her hard palate, her soft palate, her tonsils. Ma'am, can you open your mouth? Can you stick out your tongue? Okay, and we're checking her hard palate or soft palate. Can you stick out your tongue all the way? We're checking her tonsils, make sure there's no swelling. There is no swelling. We're going to have our patient say, ah. Can you say ah for me? Ah, very good. We're also going to test the gag reflex. Patient does have a gag reflex. That's testing the vagus nerve and the glossopharyngeal nerve. Next, we want to inspect the patient's tongue. Man, can you stick out your tongue? All right. Can you move your tongue, turn your tongue to the right and then to the left? And we're just noting color, any nodules noted, and there is none noted at this moment. Next, we want to inspect the patient. We're going to want to test cerebral function for her facial. So we want to first have the patient, can you squeeze your eyes shut real tight? Tight for me. Very good. Okay. Can you open your eyes? Can you raise your eyebrows up for me? Very good. Can you smile big for me? Very good. All right. And then we're going to do the temporal nerve test. So we're going to test for sensation throughout her face. So first, tell me if it's soft or dull or hard, dull or sharp.
Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp.
Very good. You can open your eyes now. Next, we also want to assess her SCM muscle. And so what we're going to have you do, ma'am, is I'm going to have you open your mouth. There you go. And then can you close your mouth? Very good. Can you open your mouth again? And can you move your jaw side to side? Very good. All right. We also want to go back to the nose. We would, around the nose, we would be assessing to her sinuses. We're going to palpate her frontal and maxillary sinuses. Ma'am, any tenderness?
Mm-mm.
Any tenderness there?
Mm-mm.
Very good. After we've assessed her head, neck, head, ears, eyes, nose, and mouth, we're going to go to her neck. We're going to be assessing, can you lift your head up just slightly? There you go. We're going to be inspecting for her trachea, making sure that her neck is midline, that her trachea is midline. We also want to assess for any JVD and inspect on the side. Any JVD at this time, we're noting none. At this level of a 90 degree, if we saw any JVD, we might suspect heart failure. We're seeing no JVD at this moment. We're also wanting to check symmetry and then also angles of her muscle, of her neck muscle. We're going to want to palpate her trachea and just make sure that it's aligned. And we do this one finger. We also want to palpate her carotid pulses, noting we're only going to palpate one at a time to prevent any vagal maneuver or syncope. Pulses are good, add 2. While we're here at the carotid, we're going to check for any bruise. I didn't feel any thrills in her pulse, but we're going to auscultate for bruise. Lean your head up just a little. There you go. Very good. So I heard no thrills when auscultating. We're going to check her range of motion with her neck. So ma'am, can you turn your head left and right? There you go. Up, can you turn your head up and down? Very good. Can you touch your right ear to your shoulder? Okay, can you do your left? Very good. I'm going to put my hand to your right cheek. Can you press against my right hand? Very good. I'm going to do the same with the left. Very good. And that was my left hand and my right hand. After I've assessed, so her muscles, range of motion seems to be intact. We're gonna assess her lymph nodes, and we're gonna start. And I'm just gonna palpate your lymph nodes. Preauricle, postauricle, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, subclavian. We're also going to do, while we're here, we're going to do mid-axillary lymph nodes. Ma'am, can I have you lift your arms ever so slightly? And we're just going to, underneath you, there we go. We're unable to palpate, or there is no swelling, no enlargement of any of the lymph nodes at this time. We're going to also, while we're still here at the head and neck, we are going to test for her spinal accessory nerve. So what I'm going to have you do, ma'am, is I'm going to put my arms on your shoulders, and I want you to shrug your shoulders up. This is going to be testing for the trapezius muscles. There you go. Very good. All right. Next, we're going to assess her chest. We're first going to start posterior. So, ma'am, would you mind just turning to, there we go. All right, so we're going to first, keeping the patient as covered as possible and as least exposed, we're going to assess the posterior chest first. We're going to inspect for any redness, any skin breakdown, any masses. We're also going to palpate her chest, her post chest, noting any kind of masses, any inflammation, any tenderness. Next, we want to test for tactile fremitus. And so what we're going to do is, ma'am, when I put my hands on your back, I want you to tell me, say 99 each time I put my hands on your back.
99, 99, 99, 99.
Very good. Noting no abnormalities in vibrations. We're going to percuss the patient's posterior chest, and we're going to be doing this in a ladder-like motion. Checking for any dullness. Good. Next, we're going to assess her diaphragmatic excursion. So what I'm going to have you do, ma'am, is I'm going to have you take a deep breath and then let it all the way out and hold that position right there. Okay, go ahead. Let it all the way out and hold. Noting for when we feel any dullness. Ma'am, what I'm going to have you do now, and I'm going to make a notch right there, make a note right there. Ma'am, what I'm going to have you do now is take another deep breath and hold that breath in. Okay. Go ahead. Very good. Okay, and we've noted our distance between. We'll measure the distance between those two, and it looks to be about 4 centimeters, which is an appropriate number for it. Next, we're going to auscultate her lung sounds at this position. Ma'am, I just want you to breathe normal for me. Take a breath. Normal breath. Very good. Take a breath. Breath. Good. And our lung sounds are clear on all lobes. At this moment, ma'am, we'll have you turn around and we'll assess the anterior chest. When we get to the assessing the anterior chest, if you have a female patient, we would have a witness, a female witness, either a tech or an RN, stand by as I assess the patient. So what we'll do for the anterior chest is we want to inspect her chest again, noting any any skin breakdown, any changes in color, any redness. We're going to be looking for symmetry, and we'll be looking for the same in the posterior as far as any change in respirations. Oh, and let me have you turn around one more time. We're going to check your lung expansion real quick, if you don't mind.
Yeah, no problem.
We're going to assess her lung expansion. So, ma'am, can you put my hands down the lower 10th rib, and can you take a deep breath for me? And as my thumbs expand, okay, and you can take release. Very good. Okay, good. All right, now you can turn back around. All right. I was saying we're going to be inspecting her chest, making sure equal rise and fall. We're going to be looking for symmetry on both sides. We're going to be inspecting for any redness, any breaks in skins, any nodules. At this moment, we'd be inspecting her breasts, making sure that they are also symmetrical, noting any noted bumps or nodules that we see. After we've inspected, we want to do a percussion. And we should have done that in a ladder-like formation. After we've percussed, we're going to want to listen to her lung sounds again. Breathe normally. There you go. I'm going to check lateral too. And ideally, listening to her lung sounds, skin to diaphragm is the optimal way to listen to the lung sounds. While we're here at the anterior chest, we're going to want to assess her heart. She's fairly thin, and so we want to check assess her symmetry for her chest, anterior and posterior. She is not barrel chested. That could be a sign. If she was, that would be a sign of COPD or emphysema. She is not. We're going to be assessing the heart and seeing how that she's thin. We could palpate for her apex. To palpate for her apex, we're going to also listen to her heart tones. Very good. And clearly here, S1, S2 at this moment. After we've assessed her anterior chest and her breast, we would now be moving on to her abdomen. So ma'am, what I'm going to have you do is I'm going to have you lay back. Once again, we're going to limit the amount of exposure, and we are going to cover her up. First, we're going to inspect her abdomen. We're going to be noting her abdomen is flat, non-distended. looking for any masses that we might see to the eye. We're not seeing anything at this moment. With the abdomen, we do want to start after inspection with listening for bowel sounds. Bowel sounds are normal active. We would make note if there was any hyperactive or hypoactive, but at this moment they're not. We're going to percuss her abdomen. Noting any dullness. Okay. And now we want to percuss her her liver. We would start first at mid-clavicle, around her umbilicus, and work our way up. Note once we get to dullness, okay? We would come from just below the nipple line, mid-clavicle, working our way down till we hear dullness. Her liver does not appear to be enlarged at this moment. We're going to also do the spleen, percuss for her spleen, and note any dullness. Good. After we've percussed, we want to palpate her abdomen. We want to first start with a light palpation, noting any mass, any tenderness that the patient may exhibit, looking at the, observing the patient's facial expression. Ma'am, any pain at all when I'm palpating here?
No.
Good. Next, we're going to want to do a deep palpation. We're going to first start off with the liver. We're going to put our left hand underneath the patient's back and our right hand here. We're going to palpate. Okay. Next, we're going to do the same with the spleen. We're going to put our left hand underneath the back and palpate for the spleen. And we're not feeling anything with the spleen, and that's normal. The spleen is non-palpable. We're also going to palpate, deep palpate the kidneys and the right kidney. Okay, very good. While I have the patient in this position, we'll continue with going down and assessing her hip. So I want to expose the patient a little bit. And we're going to first start off with hip palpate, noting any, inspecting the hip, noting any deformities and the lower extremities, noting any deformities, any break in skin, any redness. We're going to palpate the hip, noting any crepitus, any grimace from the patient. Next, we want to check the hip range of motion. So we're first going to start out with, ma'am, I'm going to bring your leg up and we're going to do extension. Flexation, extension. We're going to do abduction, adduction. We're going to do interior rotation and exterior rotation. Very good. And we'll do the same with the other leg. We're going to do flexation, extension, abduction, adduction, interior rotation, and exterior rotation. Very good. We're going to assess the patient's lower extremities, noting any skin deformity, noting redness, noting any swelling. We're also going to be looking at hair formation and hair distribution. We're going to be next assessing the patient's knee and range of motion with the knee. First, we'll assess the palpate, the popliteal pulse, and she has a good 2 and 2+ for both popliteal pulses. For the knee, I'm gonna have you raise your knee up now, okay? And we're gonna assess extension, flexion, interior rotation, exterior rotation. Very good. And we're going to do the same with our other knee. And do extension, flexion, interior rotation, and exterior rotation. Very good. We're going to continue down, noting any abnormalities to the skin, any open skin, any swelling to her feet. We're going to check her PT pulses. There are 2+, and her PT pulses, and 2+. And same with the left foot. Very good. We're going to test for the patient's. We're going to palpate the patient's foot, noting any kind of crepitus, any tenderness, not seeing any. We're looking at the skin too, noting any redness, any breaks in skin. We're going to test the patient's range of motion for her feet. Ma'am, I'm going to have you press against my hands, bring your toes towards you, okay? Very good. And that's the dorsal flexion. And then I'm going to have you push against my hands, there you go, and plantar flexion. Very good. While we're down here at the lower extremities, what I'm going to have a patient do is assess cerebral nerve. So ma'am, can I have you raise your right leg up? I just want to hold it up straight, just like that. Keep it up. All right. Okay, you can lower it down. We're going to have you do the same with the left leg. Raise it up and hold it. Very good. We're going to have our patient do a heel to shin test. So ma'am, what I'm going to have you do is with your left foot, I want you to take your heel to your shin and bring it up and down your shin. There you go. Very good. And can we do the same with the right? Very good. All right. I'm going to have you sit up, ma'am. Okay. We're going to continue our assessment with the upper extremities. I'll have you turn this way. There we go. Have you continue with the upper extremities. We're going to be first noting her shoulders, making note of any asymmetry, making sure that the shoulders are symmetrical. We're going to test the range of motion of her shoulders. So we're going to have you first raise your arms up. There you go. Checking for abduction. And then I'm going to have you bring your arms crossed in front of your chest. There you go, for abduction. I want you to bring your arms above your head. There you go, for extension, for flexion. And then have your arms go behind your back for extension. And then what I want you to do is bring your arms behind your hand behind your head for external rotation. And then your hands behind your back for internal rotation. Very good. Any pain at all when doing those? Good. We're also going to test for cerebral nerve. So what I want you to do is I want you to bring your arm up and hold it there for just a few seconds. Very good. Noting any arm drift at all. Okay, can you do the same with the other arm? Very good. We're going to continue on. Continue on down the arm. We're going to test her elbow range of motion. So I first want to do flexion and extension, and I want you to bring your hand to your chest against mine. There you go. Okay, and now push away. Very good. Okay, and the same with this one. Very good. And push away. Very good. We also want to check her brachial pulses. and they're 2+. We're going to inspect her arm, inspect the skin, inspect for any breakdown, any the hair distribution, any other lesions, nodules, anything that we might see. When we come down to the hand, we want to inspect her hands, inspect her fingers. We're going to be testing cap refill on her nails, making sure her nails have a nice color to them. We're going to be testing patients' range of motion with their fingers. So we're going to have you spread your fingers out for abduction, and then I want you to bring your fingers close for adduction. Very good. And then we're going to test this. Can you do the same with the other hand? Very good. Very good. And then I want you to test cerebral and squeeze my fingers. Very good. Okay. Now what I want to do is we're going to test. I need for more cerebral. So I want you to close your eyes and tell me what is written on your hand.
3.
Very good. And then keep your eyes closed, and then tell me, can you describe what's in your hand?
It's a key.
Very good. We also want to do a few point-to-point tests right now. So what I have you do, ma'am, is with your index finger, touch my finger, and then touch your nose. And then continue to do that again. Okay, and then with the other hand. Very good. Very good. Okay. Finally, we're going to do another cerebral test. With your hands laying flat, I want you to flip them over, and then do it real faster for me. Very good. Okay, so I'm not seeing any abnormalities there. All right. Next, we're going to test her reflexes. So first, we're going to test the tricep reflex. I'm just going to do a little bit of it. Very good. The brachial reflex. Okay. Okay, spread. There you go. And the Achilles reflex. Very good. And we would do the same for the other side too. Finally, we want to check gait and ataxia. And can I have you come down off the table for just a second? Okay. First, we're going to test for ataxia. So, ma'am, I want to have you keep your feet close together and close your eyes and stand there for a few seconds. Okay, very good. You can open your eyes. Next, we want to check for gait. So what I'm going to have you do, ma'am, is walk heel to toe towards me. Very good. And turn around. And then can you do the same in that direction, just on your toes? Very good. And you can turn around. And can you walk back towards me on your heels? That's good right there. And we'll have you come back over here. And then we also want to check your range of motion. If you can bend down and touch your toes for me. Very good. And we're going to be noting her spinal column, noting any, making sure it's aligned, noting any deformities. Can you sit up just a little bit? There you go. We're going to make sure that it still stays just as aligned. You can come all the way up. All right. And at this moment, we've assessed the patient's head to toe. Thank you.